Good afternoon, everyone. So a couple things before we get started today. First, apologies on my behalf. I do have an important meeting at 3:30 I need to duck out on, so the vice chair will take over. I will try and be back within half an hour. Hopefully you won't still be going by that point, but you might be. It's okay. And also, and I will introduce her when she gets here, but we have a new subcommittee member. We have Delegate Dana Jones, who will be replacing Delegate Henson. So one District 30 member for another, so even swap for Anne Arundel County there. But she will get here as soon as she can, and we will go ahead and begin. Today we have one budget on the agenda. It's the Department of Human Services Family Investment Administration. We will start with the analysis from Tanya Zimmerman.
Thank you, Mr. Chair. I'm going to begin with the analysis of the Family Investment Administration and the Department of Human Services, which is the administration that administers the cash benefits and other grant programs. The fiscal 2024 allowance decreases by about $348 million, or 11.1%, to $2.8 billion. This decrease is driven by the pandemic EBT benefits, which are not specifically budgeted in fiscal 2024. If you turn to page 6, that begins the discussion of the first of the performance measures, which is related to application processing timeliness. Since the start of the pandemic, after the kind of initial surge in applications for the benefit programs were kind of below typical levels. This primarily occurred due to the extension of the recertifications. That extension ended in December 2021, and since that time, applications began to increase once again, and for SNAP have exceeded pre-pandemic levels in each month since April 2022, and have increased compared to the period prior to the restart of the recertification for TCA and TDAP. Since the restart of recertifications, the application processing times, the average days to process applications have generally increased for all three programs. If you look at the bullets on page 7, they've increased by about 2.3 days for SNAP, which has the lowest application processing times due to requirement that some of the benefits be processed in 7 days, about 4 days for TCA, and about 4.7 days for TCA and TDAP. TCA and TDAP have generally similar average days to process applications, but the percent of applications processed within certain amounts of time differ significantly between the two programs because of the additional requirements for documentation about medical certification of disability and other requirements that make TDAP application process a little more challenging. If you turn to Exhibit 3 on page 10, this presents information on the percent of applications processed in longer than 46 days. As you can see in this exhibit, these percentages are higher for TDAP in really almost every month and have exceeded 40% in 2 of the months since the restart of recertifications. In general, application processing times have worsened since the restart of recertifications, and we've asked the department to comment on the decline in application processing times since the restart and the steps being taken to improve performance. Exhibit 4 on page 11 presents information on application denial rates for these 3 benefits. The application denial rates are higher for TCA and TDAP, over 50% in each month, compared to SNAP, which is generally under 30%. Through December 2021, interview requirements were waived for the 3 benefit programs. There's a limited waiver still in effect for expedited SNAP cases. Since the reinstitution of the requirement for interviews, missed interviews has been a top reason for denial among the 3 benefit programs. As you can see in Exhibit 5 on page 12, it's a much higher share of the reasons for application denial for SNAP than the other 2 benefit programs. And for the TCA and TDAP benefits, verification and non-cooperation related reasons are a top reason for denial, with about 30% in each month. And we've asked the department to discuss the efforts they've undertaken or plan to take to reduce the number of applications denied due to missed interviews and missed verification and documentation. Exhibit 6 provides information on the distribution of the TCA caseload among work eligible or work exempt. The child only and the other categories are the work exempt cases, and employable are the work eligible cases. The work exempt cases, in addition to child only cases, include situations where the recipient has a child under the age of 1, or they're a caretaker, or state-only cases. In general, in periods of good economic times, the share of the caseload that's work exempt increases, while the share that is work eligible decreases. With the onset of the COVID-19 pandemic, the share of cases that were work eligible increased substantially, about a 13 percentage point increase between July 2019 and July 2020, which was just 1 month after the peak caseload in TCA. At 59%, it was significantly higher than in all recent years. Unlike other periods of economic improvement, as the economy has improved, the share of cases that were work eligible has actually increased, and it was about 74% in July 2022. Although the work eligible cases decreased, the work exempt cases decreased by even more. This primarily occurred due to state-only cases and child-only cases. State-only cases include immigrant families and two-parent households, and these were much higher than typical during the pandemic, but are decreasing to more pre-pandemic levels. DHS attributed the decrease in child-only cases to trends consistent with the returns to pre-pandemic levels, but DLS notes that the level of child-only cases in July 2022 was less than half of the pre-pandemic levels, and we've asked the department to discuss the cause of the substantial decrease in child-only cases. Chapter 509 of 2022, among other changes, added and altered state exemptions from federal work requirements effective October 1. With these state exemptions, these individuals still do count as part of the federal work participation rate calculation. These affected situations in which the individual had a child under the age of 1. Under federal rules, there's a 12-month limit on that exemption, and under Chapter 509, it prohibited the department from having a lifetime limit on that, and it also added a new state exemption for new TCA customers. In the first 3 months, the number of state child-only, state underage 1 exemptions was relatively small, and even in December was only 0.5% of the work-eligible cases. The number of new TCA customer exemptions was significantly higher. In November 2022, it was about 3,500 cases, about 25.5% of the work-eligible cases. And the department reports that if, on average, about 20% of the work-eligible population is exempt under a state exemption, that there will be a substantial impact on the state's work participation rate. Prior to the implementation of these exemptions, the state failed to meet the required work participation rate in federal fiscal 2021. This was influenced by suspensions and modifications of the work requirements during much of the period of the pandemic through December 2021. In that year, Maryland had an adjusted standard of 14.3%, but achieved only 3.4% and was assessed a penalty of $10.6 million. Maryland is in the process of applying for a good cause waiver to reconsider and eliminate the penalty, but is awaiting a response. In addition to the penalty, a state's required maintenance of effort increases if in any year they fail to meet the work participation rate. And we've asked the department to comment on the status of the review of its good cause waiver, the factors that impacted the ability to meet the work participation rate, and the likelihood the state will fail to meet this rate in federal fiscal 2022. Turning to page 16 begins the discussion of the three proposed deficiency appropriations for the agency. They total about $606 million. The largest of these is about $595 million in federal funds for SNAP benefits and pandemic EBT benefits. About $371 million of that is for pandemic EBT benefits, which were not specifically budgeted in fiscal 2023 as enacted. However, benefits were paid for the prior school year, the summer 2022 program during fiscal 2023, due to the timing of receiving federal approvals. The state is planning to apply for the school year and summer program for this year. And if they receive approval, those benefits, some of the benefits would be paid in fiscal 2023. A second deficiency of about $7 million is from a SNAP administrative grant that was available through the American Rescue Plan Act. This provides the last of the remaining funding under this grant, which expires September 2023. And the third is about $4 million in general funds, which is the local Family Investment Administration share of the Montgomery County Block Grant deficiency, which you've heard in several other budgets, to align the fund split with the most recent actual experience. Exhibit 7 on page 18 provides information on the assistance payment spending. This spending is about 89% of the total allowance for the Family Investment Administration. SNAP spending of about $2.2 billion is about 90% of the assistance payment spending, or about 80% of the Family Investment Administration allowance overall. TCA is about 7% of the assistance payment spending, or about 6% of the allowance overall. Exhibit 8 on page 19 presents the spending in family investment aside from the public benefits. This totals about $314 million, more than half of which is for personnel, primarily due to the caseworkers that are involved in the eligibility determination and case management. About 42% is for contracts and grants, the largest of which are in the area of employment and training, and the second largest is for the Maryland Office for Refugees and Asylees. Page 20 begins the discussion of the changes in the fiscal 2024 budget compared to fiscal 2023. As noted, the budget decreases by about $348 million, nearly all of which is in the assistance payments program. Aside from the assistance payments program, the budget decreases by about $0.3 million. However, that small kind of level funding masks some kind of significant swings in individual areas. I'll draw your attention to the first line on page 20, which is about $6 million for the minimum step increases that were provided in November 2022 for family investment specialist classifications, but funded with vacancy savings in that year. At the top of page 21 are the changes related to the assistance payments program. These are primarily caseload driven or not budgeting the pandemic EBT benefits in fiscal 2024. The next set is in the Maryland Office for Refugees and Asylees. This is all federal funds. It's an increase in total of about $15 million, and it's primarily due to the increase in refugees and humanitarian immigrants from Ukraine and Afghanistan, as well as a request from the federal government to provide 12 months rather than the typical 8 months of refugee transitional cash assistance. The other notable change that I would mention is towards the bottom of that page. It's a decrease of $10 million for the food banks and that was provided through the dedicated purpose account. This is really just a timing issue. There's actually no decrease in the funding for the food banks. The funds in fiscal 2024 are budgeted in the dedicated purpose account, whereas the money has been moved to the department in fiscal 2023. So it's the same amount of funding overall. Page 22 begins the discussion of some of the public benefit programs. The first relates to SNAP. Since April 2020, the state's been able to issue emergency allotments where households receive the maximum allotment for their household size. This was expected to continue until 1 month after the end of the National Public Health Emergency. However, the Federal Consolidated Appropriations Act of 2023 provided a set end date for these allotments in February of 2023, and there's no option to extend it beyond that period. The department indicates that average benefits will decrease by about $170 per month per case after the end of the emergency, or with the end of the emergency allotments. Despite this, the fiscal 2024 allowance assumes average benefits will increase from the levels that account for both emergency allotments and pandemic EBT benefits, and as a result provides additional funding for SNAP despite a caseload decrease of about 14%. Assuming the same average caseload as assumed in the allowance at an average benefit that's about a little higher than what the department indicates it expects to occur after the end of the emergency allotments, the total funding requirements for SNAP in fiscal 2024 would be about $1.26 billion, which is about $960 million less than the fiscal 2024 allowance. This provides additional funding that may be needed to pay for pandemic EBT benefits, a new nationwide program that I'll discuss in a moment. But in general, any excess federal funds appropriated but not needed would be canceled at the close of the year because these are just a pass-through funds and the state doesn't receive them if there are no benefits to issue. And DLS recommends reducing about $100 million of this excess funding, but leaving most of the surplus for potential other needs for PEBT and the new nationwide program. On page 23, there's a discussion of additional benefits. There have been additional benefits of varying levels provided since January 2021 to TCA and TDAP recipients. In fiscal 2023, $35 million in the dedicated purpose account was provided for an additional $45 per recipient per month for TCA and TDAP recipients, which appear in the FIA's budget as special funds. The fiscal 2024 allowance continues the additional benefits with the program's regular fund sources, and it's been expressed that this additional benefit is intended to be permanent. Providing an equal benefit to all recipients provides a disproportionately higher benefit to recipients that would otherwise qualify for a lower benefit. We've asked the department to comment on whether a permanent change to the benefit calculation would provide a more equitable impact of a higher benefit level. Exhibit 10 on page 24 presents information on the number of TDAP recipients since fiscal 2019. The number of recipients kind of leading up to the budget introduction last year was around 11,000, and the budget was introduced with a level of funding that could support around that level of recipients. This was kind of just below the pre-pandemic levels. However, with the restart of recertification, the number of recipients declined to really all-time program lows in June of 2021. It has since rebounded to between 8,000 and 9,000 in the subsequent months, but in December 2022 was 29% below the pre-pandemic levels. Due to these lower than budgeted number of recipients, DLS forecasts a surplus of general funds of about $9.4 million in TDAP in fiscal 2023. DLS generally agrees with the funding estimate for fiscal 2024, but notes that the caseload estimates in that year would still be about 17% below pre-pandemic levels. Exhibit 12 on page 26 presents the number of recipients of TCA since fiscal 2019. With the restart of recertifications, there was a decrease of about 15.5% in the number of recipients between January and April. The number of recipients has rebounded some since then, but remains below the level prior to the restart of recertifications. And this was a level higher than the budget itself was intended to support. However, in December 2022, the number of recipients fell to kind of around the level that the budget estimated. And if those trends continue, DLS forecasts the fiscal 2023 budget would be in line with the spending needs. In the event that the recipient count is higher than forecasted over the second half of the year, there should be sufficient funding available from unneeded support for the other public benefits to offset any shortfall. The fiscal 2024 allowance appears more than sufficient to cover anticipated benefits for TCA in that year, as DLS currently estimates a lower caseload. However, DLS is not recommending any surplus funds be reduced, but instead recommends adding language restricting the general funds for the assistance payments program to that purpose only, so that any surplus would revert to the general fund. Page 28 presents information on the personnel. There were 294 vacant positions as of the end of the calendar year, and a vacancy rate of about 15.3%. This is nearly double the number that would be needed to meet the level of turnover expectancy, but does represent an improvement over the prior year. In total, there's about 40 fewer vacant positions compared to the prior year, and about 56 and a half fewer vacant family investment specialists, which are the caseworker positions. The bottom of page 28, continuing on to page 29, discusses contractual full-time equivalents that were hired during fiscal 2022 and fiscal 2023 using the SNAP administrative grant that I mentioned earlier. These were intended to assist in processing redeterminations as they restarted the eligibility redeterminations. The department indicated that they plan to continue to recruit for these roles until March 31st of this year, and that these people hired into these roles would have the opportunity to convert into regular state positions. On January 6th, the department indicated that there were 190 unique individuals had been hired into these roles, of which 136 remained with the department on that date, 47 of which had converted into regular state positions. The department didn't have a set timeline for transitioning the remaining contractual FTEs, but indicated that they did plan to work to transition those who were interested. And DLS recommends committee narrative requesting information on the final number that were converted. The first issue in the analysis begins on page 33 and relates to case closures. These case closures have increased with the restart of recertifications that I mentioned earlier. Exhibit 16 on page 34 presents information on the SNAP case closures and reasons for case closures. Case closures were relatively limited during the period before recertifications restarted, but increased to over 60,000 in each month from March to June 2022, before declining and then kind of staying in the 30 to 40,000 range. Since the restart of recertification, failure to reapply and recertify has been the predominant cause of case closures, with about 80% of case closures due to this reason in 7 of the 9 months of available data. Exhibit 17 on page 35 presents similar information for TCA. Again, case closures increased after the restart of recertification. And in 6 of the 9 months, the failure to reapply was the leading cause. However, verification on non-cooperation reasons were a significant cause, the second leading cause in most months, or the leading cause in a few months. DLS notes that some individuals may choose not to reapply because they believe they're not eligible, but we have asked the department to comment on efforts they've made to improve outreach so that those who remain eligible are able to maintain benefits. TDAP has a number of additional requirements relating to the length of time for the disability and medical certification of disability, and certain requirements related to SSI that provide a kind of wider range of reasons for case closure than occur in the other programs. Exhibit 18 on page 37 presents information on the reasons for case closure for TDAP since October 2020. No eligible members has kind of been the leading cause or the second leading cause of case closures in recent months, though SSI requirement kind of compliance was the predominant reason in the most recent months, with over 50% of case closures due to this reason. No eligible members in the past had primarily been used when there had been a final determination on SSI or SSDI applications. However, with the change in the eligibility system, this closure code now reflects additional technical eligibility factors, including medical certification of disability. And it makes it difficult to understand whether individuals are experiencing specific barriers related to this medical certification of disability or other eligibility requirements. And we've asked the department to comment on the share of recent closures that are related to difficulties in obtaining medical certification of disability, and also discuss whether the recent increase in closures related to failing to meet SSI, SSDI requirements are related to some of the federal processing difficulties that have occurred recently. The second issue relates to supplemental benefits for periods in which children are not in school. Legislation in 2019 created the Summer SNAP for Children program that provides $30 per month in the summer months and $10 in the month of December per child in a household for participating jurisdictions. It's a limited benefit because the funding is only available. There's only a limited amount of funding available, so not every child in every SNAP household receives the benefit. With this program, there's state funds, and it requires a local match based on the public school construction match rate. The mandated funding for the program is $200,000, but the fiscal 2023 budget provided $5 million of state funding, and the fiscal 2024 allowance continues that level of funding. Exhibit 19 on page 39 presents information on the number of children receiving benefits through this program in the 3 years since the program has been available. As you can see, the number of jurisdictions participating and the number of children receiving benefits substantially increased in fiscal 2023 with the higher funding level to over 100,000 compared to less than 5,000 in the year prior, with 14 jurisdictions participating compared to 6 in the prior year. Exhibit 20 on page 40 presents information on the share of eligible children in the participating jurisdictions that receive the benefits. In prior years, it was only about 2%. In fiscal 2023, it was 56%. This was influenced by several jurisdictions which provided more than was required so that all children that were eligible could receive the benefit. And this can also be seen in Exhibit 21 on page 41, which provides information on the state funds per jurisdiction that participated, the local contribution, and then the difference from the required contribution. So 3 jurisdictions provided more than was required so that all eligible children could receive the benefit. There were 9 jurisdictions, however, that failed to meet the required contribution, which appears to be related to a misunderstanding of how the contribution is meant to be calculated. DHS concurs that some jurisdictions did not meet the required match and has stated that it intends that this will not reoccur. Page 42 provides information on a new nationwide summer EBT program that was created in the Federal Consolidated Appropriations Act of 2023. This new nationwide program would begin in summer 2024, and states will be required to submit a state plan to administer the program. In that initial year, the benefit is $40 per month per eligible child, which would be increased in subsequent years with inflation. And it would be available to those participating, those who are eligible for free and reduced price meals. This new program appears to overlap or duplicate the state program for the state summer SNAP program. Some of the differences, though, between the programs are noted in the bullets on page 42. These include that the existing state program provides a total of $100 per eligible child compared to $120 under the new nationwide program. Of the $100, 10 of that is provided in December, whereas the new nationwide program provides no benefits in December. The funding for the state program is state funds with a locally required match, while the new program would be federal funds with the state only being required to share in administrative costs. The other key difference is availability. Under the existing state programs, jurisdictions have to choose to apply, and it's limited to the available funding, while the new program would be available throughout the state. And DLS has recommended committee narrative requesting a report on the state summer SNAP program in fiscal 2024 and additional information on the new nationwide program, including the overlap between the programs. The third issue relates to EBT card skimming. The beginning of this provides information on the number of individuals impacted in recent year in calendar 2022. There were about 2,300 overall incidents with about 1.7 million in lost benefits. The majority of this is in SNAP benefits, but there have been lost benefits in the cash assistance programs as well. Prior to the enactment of the Federal Consolidated Appropriations Act, the state was unable to use the federal SNAP dollars to replace SNAP benefits. However, the new law requires the reimbursement for SNAP benefits due to loss due to skimming from October 1, 2022 through September 30th, 2024. The reimbursement for those SNAP benefits will be provided with federal funds, and states have to submit a state plan prior to reimbursing, and those state plans were required to be submitted by February 27th. The replacement cannot begin until approval is received of the state plan. This only impacts the SNAP benefits that are lost. However, the department indicated in testimony that it would consider replacing the cash assistance benefits lost due to skimming with some of the savings from the higher than expected vacancies. And we've asked the department to comment on the status of the submission of the state plan and the timing for reimbursing cash assistance benefits that were lost due to skimming. We've also asked the department to discuss actions that it's taken or plans to take to improve the security of EBT cards. The final issue in the analysis relates to a fiscal compliance audit that was released in October 2022 for family investment. There were 10 findings overall, of which 5 were repeated. I'm not going to go over the findings. They're discussed through the remainder of the issue, as well as the department's response to them, and they're listed in Appendix 2. Due to the number of repeat findings, DLS recommends adopting language restricting funds pending the resolution of the findings. The recommended actions begin on page 49. The first three, all three on that page were discussed during my presentation. Recommendation 4 on page 50 is committee narrative, requesting reports on application processing times, denials, and case closures that were used for this analysis. Recommendation 5 relates to the summer SNAP program that was mentioned earlier. Recommendation 6 on page 52 requests that the department submit, when the budget is submitted next year, separately identifies the pandemic EBT spending and any spending related to the new summer EBT program. And the final recommendation is related to the repeat audit findings. The remainder of the analysis provides an update on the pandemic EBT distribution, as well as some measures related to the job placements and retention, as well as the SNAP employment and training program. And that concludes my presentation.
Thank you, Ms. Zimmerman, for the presentation. That was very thorough. Do any of my colleagues on the committee have any questions for our analyst? I have one. So going back to exhibit number 7, and I don't know if this question is most appropriate for you or for DHS, so I apologize if it is not best for you. But going back to exhibit number 7 on page, here we go, on page 18 of the report, the section that says child support pass-through, $5 million, is that money, to your knowledge, is that money that is withheld from families and paid to the federal government pursuant to their regs, or is this the money that is taken from the payment from the non-custodial parent and then passed along to the custodial parent?
So that particular set of funding is the portion that the state does distribute to the custodial parent from the child support that's received. The state does use some of the funding, some of the rest of the funding, because there are limits in what's allowed to be passed along. And so that does support the TCA program as well as some other programs. But that particular set of funding is the funding that's collected and distributed to the custodial parents.
Do we know the number that is withheld for the state and used for TCA and all the other programs?
I don't have that with me. I can get back to you on that.
Okay, thank you. Any questions? Last call? Okay, thank you. Bringing up our friends from the administration now, Secretary Lopez from DHS and Executive Director Ayala from the Family Investment Administration. And your panel. You may begin when you are ready.
All right, good afternoon, Acting Chair Shetty and honorable members of the committee. I'm Rafael Lopez, Acting Secretary of the Department of Human Services, and we're grateful to have this opportunity to walk you through a couple of the items that our analyst has mentioned. I want to start with sharing who's at the table with me. To my far left is Carnita White, who's our new Deputy Secretary of Programs for the department. Next to her, to my left, is also Safford Chipungo, our Chief Financial Officer, and to my right, Lashira Ayala, who's the Executive Director of the Family Investment Administration. Behind us in our audience are a variety of individuals who are leaders, both in the department and throughout the state of Maryland. Daniel Waite, Acting Deputy Secretary of Administration. Agustin Natabagana Yamana, the Deputy Executive for Programs, Family Investment Administration. Marie McClendon, Deputy Executive for Operations for Family Investment Administration. Linda Webb, Director of the Talbot County Department of Social Services. Shelley Neal Edwards, Director of Kent County Department of Social Services. And of note, we have been trying to bring our MASTI partners, the Maryland Association of Social Service Directors, to make sure we can respond to jurisdictional questions as well. Before diving in, I want to thank our analyst, Tanya Zimmerman, for her comprehensive analysis of our department's budget. And I want to remind folks that we submitted our written testimony. So rather than go through that again orally, I want to lift up a couple of the main items that I imagine are top of mind for all of you. Certainly top of mind for me are the over 1 million residents of Maryland who are our clients and received services from us. And to make sure that happens, top of mind for me are the also 5,000 team members of the Department of Human Services who each day provide the services to make sure those folks get what they need when they need it. And in my first few weeks on the role, it's become crystal clear that in order to deliver better results for Marylanders, we must proactively support our workers, reduce vacancies, better manage caseloads, ensure worker safety, and create worker experiences that recognize their importance in every community across the state of Maryland. So that said, first I'd like to turn your attention to the recommended actions and issues. We concur with 6 of the 7 recommended actions, so I'll not repeat those as our analysts has walked through those. I do want to draw your attention to the difference of opinion we have with recommended action number 2, which we respectfully do not concur with. We believe that this recommendation will deny our new administration the ability to manage these issues more comprehensively, especially in light of the tremendous amount of fraud that has been experienced by many of the people in Maryland and across the country. So we ask for your time and consideration so that we can increase our effectiveness rather than the immediate imposition of restrictions that are likely to have the opposite impact on performance and management flexibility. So next, I'll turn our attention to the 14 issues brought to our attention. Again, I'll not repeat those. We concur with all of the recommendations. We will swiftly report on all of those matters and be much more transparent so that you have the information you need and all those. And what I'd like to do is spend a little bit more time on issue number 12, which is on page 44 of your analysis, as well as issue number 13, page 44. This, as you can imagine, have been on the front lines of news and of conversation, not just across the state of Maryland, but across the country. And this has to do with benefit fraud. So what I'd like to do is break this up into 2 components. First, I'd like to invite my colleague, Ms. Ayala, to talk to you about our operational plan that we have that is live, and we'd like to go into more detail because there's lots of good news to share there. And then I'll go into a couple of key components that we want to share with you that literally has been changing over the course of the last 48 and 72 hours. Ms. Ayala.
Yes, thank you, Mr. Secretary, and good afternoon. For the record, my name is Lashira Ayala. I'm the Executive Director for the Family Investment Administration at the Maryland Department of Human Services. So as far as operationalizing our response to this unfortunate series of events with EBT fraud, we aim to be simple, seamless, and swift. And in that, for those Marylanders who unfortunately have become victims of fraud, we will have a simple process by which they are able to submit claims regarding the fraud that has happened to their cases. With the one entry point, again, we want it to be extremely simple in that they only have to share the unfortunate event one time. They will not be required to retell the story. We will be seamless in that the one time that they do have to share the information, we will use that to ensure that we replace all benefits that have been stolen. So if they have unfortunately been a victim of SNAP fraud as well as their cash assistance benefits, with that one report, we will be able to identify the total amount of benefits that they are due, and we will do everything to make them whole, which brings me to the last point, which is being swift. We will have a dedicated team of staff that their primary function is to support this effort in addressing calls through a dedicated line in which our constituents will be able to use to, again, report the fraud, and then also ensuring that the benefits are provided to them in an efficient and expeditious manner on an uncompromised new EBT card. Thank you, Mr. Secretary.
Thank you, Ms. Ayala. And I would like to dive into a little bit more detail to make sure that you are confident about the swiftness with which we took action. So the state of Maryland submitted our plan in response to the federal government's provision of the coverage of stolen SNAP benefits. President Biden signed a bill into law last December, and then we waited as a department so we can get guidance on how the state of Maryland and other states across the country could respond to that. We took that assignment very seriously, and we are proud to report that we were the first state in the nation to submit a plan for federal review. And on Friday at 11:29 a.m., we became the first state in the nation to receive approval from our federal partners. So not only will we lead the state of Maryland, we intend to lead the country about the way in which we are going to engage the people who are the unfortunate victims of theft. We want to make sure we make people whole, that we do it in a simple, seamless, and swift way. We also are going to model different ways of engaging our partners. Clearly, all of you are key partners, both in the House and the Senate. Your ambassadorship, your credibility in your own communities, your networks, your ability to tweet or Facebook or Instagram messages will be something that we're going to try to outreach to all of our legislative partners, because it's only through your mechanisms that we'll be able to lift people up with good information and reduce bad information spread of rumors. We are also going to test next week. In fact, Ms. Ayala and myself and our Deputy Secretary were trying to plan the exact day to hold an emergency town hall meeting of all of our staff at DHS to set a very high bar on how we were going to engage the people who have been the victims of this step and model what it's like to actually have a gold standard of customer service, knowing this is going to be a first ever and very big lift for us. We're also going to call for a first ever emergency meeting of all of our community organization grantees and advocacy partners with whom we've been working across the legislature and in the community to deliver better solution for Maryland and engage them with basic things like talking points and sample tweets and sample Instagram posts so that we could all be singing from the same hymn book. Similarly, just this weekend, I had the opportunity to speak with CEO Cliff Skelton and the president of Governance Solutions for Conduit, which is our EBT processing firm. I spoke with Mark King, and this conversation yesterday was a very productive one, helping set the standard of new engagement between the Department of Human Services and this private sector vendor. We are going to do everything we can in our power to make sure that as partners, we are providing, again, that simple, seamless, and swift service. We are also looking at more innovative ways to protect our people moving forward, whether that's in increasing our education around reducing fraud, looking at locking mechanisms, and to sort of paint a picture of the future that this is not going to happen in March, clearly. We are looking towards a day where we have a universal benefit card, that the people who receive benefits from the state of Maryland can use this in a much more seamless way, whether that's with chipping technology and other factors that we're working with the private sector vendor. So we would expect that the very kind of seamless and swift services that we all expect from our banks and our credit card companies, that we lift that bar of excellence for all the people who are needing the help of the state in terms of making ends meet. So with that said, that concludes the issues. I wanted to then briefly turn our attention to the audit findings. And put simply, we concur with all the audit findings. We wanted to share with you that, as I've shared with our senior leaders from the first week we came into office, that on any repeat findings, we want to be very transparent and direct with the legislature, which is that when there are issues that we're struggling with, we're going to tell you what those are and propose a variety of solutions, whether that's staff changes or contractual changes or other things, so that we don't have year after year repeated findings. And that way, we could reduce the number of times we come before you and say it's the same thing again, and increase the number of times we're actually bringing solutions in a very new way. With that said, that concludes our testimony, and we're happy to answer any of your questions.
Thank you, Mr. Secretary. Are there any questions from members of the committee? Okay, seeing none. Thank you. All right, now we have two members of the public who have signed up to testify. We have Denise Gilmore on behalf of AFSCME and Reagan Vaughn with Catholic Charities of Baltimore. Thank you. Are you, excuse me, are you Denise? Okay, great. Are you Miss Richardson? Yes. Okay, great. Okay, my apologies. I read it wrong. Either of you may begin. Thank you.
So thank you, Madam Vice Chair, members of the committee. I'm Lisa Klingenmeyer with Catholic Charities. I'm not sure if the name with my supervisor. Okay, awesome, perfect. So representing Catholic Charities, also Welfare Advocates, which is a coalition that works to build a strong safety net and for programs that move families into economic stability. We're here in strong support of the department, and when I was preparing my remarks after reading the Secretary's remarks, a lot of what I just want to say is thank you. We really are looking forward to working with the department and their team in order to make sure that safety net programs are accessible and that families are able to build the economic security they need to be able to move off of programs entirely. Because there have been long-standing concerns around accessing safety net programs and maintaining safety net programs for Maryland families. We've seen it on the ground at Catholic Charities of families who have been lost their benefits with no notice, no material sent to them, or it was sent to them in the wrong language. And we also know, too, that the data bears this out. Maryland is one of the highest rates of deep poverty in the entire country, and a lot of that is our families who are on our safety net programs because they just simply aren't able to make ends meet on the little bit of money they get from the programs. So we are looking forward to being able to work with the Secretary to look at our safety net programs broadly and what ways you might be able to help build either in enhancements to the programs or build in workforce development for recipients who are on those to be able to build economic security. Just 3 points that we had looking at the analysis. One, we do thank the General Assembly and the administration for continuing to include that extra $45 a month for recipients on temporary cash assistance and TDAP. We would very much like to see that be a permanent part instead of being something that happens every year. So if we can make that a permanent part of the formula, that would be great. We also noted on page 27 that there is extra money that's projected in the TANF pool, and we would like that to stay in the TANF program itself. There is a lot of enhancements to the program we believe could be made. For one, you all heard a bill this session where the current practice is if someone's on TCA and receiving housing assistance, we take $60 away from them. We could use the pool of money we have to ensure we no longer take $60 away from low-income families. So we think there are some really interesting policy options we could open up if we keep the money in the program. And then lastly, we'll just say that the TANF block grant itself, the majority of that is not spent on cash assistance in Maryland. It's spent in a lot of different places, as is the extra money we have set aside. And so we believe that there's opportunities there to reinvest that money into TANF, into temporary cash assistance. And we look forward to working with this body and the Secretary and his team to realize some of these policy options the state might be able to do. So thank you so much.
Thank you. Yes, my name is Pamela Richardson, and I am a Family Investment Specialist 2 with DHS for the past 10 years, and I'm a proud member of AFSCME Local 112 Executive Board. I was actually prepared to talk about a lot of things today, but hearing from the administration today, I just have to give them a round of applause because they are really swiftly moving. One thing that I want to talk about was the EBT card theft that was causing a problem for us. Those customers come in there and they are very angry. They are very upset because they use those benefits. That's their way of living. And they come in and they attack us because all we know how to do is help them. That's all we know how to do with the benefits and the resource that we are giving to help them out. They attack us. And all we want some type of safety issues, some type of plan to protect us because we service a lot of people in the office that I work at. Just to name a range of people we service: the Ukraines, Afghanistans, people from Portugal, El Salvadorian. Sometimes we have people who just arrived in the United States. And right now in Prince George's County, Hyattsville, they're building a 500 apartment complex. And then on the back of it, we have the dorms for the college kids. So we're asking for some type of safety plan, working with some type of law enforcement to help us out when we have those type of situations that happen within our DHS office. I've been here for 10 years. My coworkers have been here for a long time. We're asking for the state government to rebuild and restructure the entire pay schedule with annual step increases that will lock us in, like myself, who have been here, to pay for the perks and like a retention bonus or something. Also, in Anne Arundel County, there is call center that's being contracted out. DHS has contracted with a private vendor to operate the customer call center. They have only been given a view-only access. When the call center was first created, DHS claimed that the call center staff will be able to make certain changes in the system. Mainly, they can only take messages. The messages go into the system called the CRM, and then the locals have to retrieve the messages and call customers back and resolve the issue. In Anne Arundel County, there's like 4 workers assigned to answer the local number and resolve those customer service issues Monday through Friday. In essence, there are 2 call centers, a statewide, which is a private contractor that have only view cases and take messages, local call center consisting of state employees who answer and resolves calls daily. It is poor customer service as well, and they're telling people that we can get back with them within 48 hours, which is not possible because our caseloads are very high at this time. Customers are waiting in the long wait lines, and they cannot move through them because we are so short-staffed. I've been here along with my other coworkers, and we want to stay here to carry God's work. But I ask and I suggest that DHS state government be rebuilt. Thank you.
Thank you, appreciate it, and I apologize for missing the department's response, but understand, having read it, I know that it was thorough. Thank you all, and thank you for getting that EBT fraud plan approved by the federal government. First in the nation is what I understand, correct? So we are moving quickly.
Yes.
Are there any questions for this panel? Seeing none, thank you all very much. And we are adjourned. We are back here on Wednesday for a very big budget hearing. It'll be the Medicaid budget. And then on Thursday for our final 2 budget hearings as well. I believe that is behavioral health and one more. Child support administration. That's it. Wednesday 1, Thursday at 1. All right. Thank you very much. We're adjourned.